We're all set. Thank you.
Thank you. Board President Doyle calling the Friday board meeting back into action. It's currently 11:21 a.m. We had left off with the completion of mailing F at the Black with Executive Director Fox. Now we move on to mailing Foxtrot 1. Executive Director Fox.
I guess it's very fitting with last name Fox.
I tried to emphasize that.
And looking at mailing F1, F1 is the KPM report that includes best practice survey results for calendar year 2022. That was combined in 2023 that the board did not receive last year that we should have provided to you in December. And I do apologize for that, but in your materials, what you can see, I'll just highlight. I'm not going to go through each and every last bar graph, pie chart. The information is there available. It's just two areas where I would say that there's various reasons in 2022 with the pandemic and everything else that was going on at the time where agency did not meet a lot of our key metrics. And the two key metrics that we did was KPM number 3 and KPM number 4. KPM number 3 is the percent of pharmacies inspected every 2 years. The team in our compliance department did an extraordinary job and meeting those. And KPM number 4 average number of days to complete an investigation from complaint to board presentation. And what we hope is as we combine the information, we'll start compiling all the data for this past calendar year, which will be combined with your best practices survey that you recently did. We just discussed from mailing F. All of that's going to get packaged and sent to the legislature no later than October 1. And so we'll be able to provide you those results later this year. There's any questions from members of the board that you want to call anything out on here, it's open for discussion. President Doyle.
Board Member Doyle, are there any board members? The floor is open to provide any comments, or if there are any questions, please raise your hand.
Member Hemmings. Executive Director Fox, did you mention that priorities that were voted on yesterday would become part of the package that's sent over? Say that just now?
No. So the survey that we just went over in mailing F that you all looked at yourself for calendar year 23, that and the other KPMs that we're responsible as an agency, all that's going to combine, and we have to send that to the legislature as it relates to statute. That's what we're required.
Not the board priorities that was voted on. Thank you.
Board Member Doyle, do board members have any other questions or comments regarding this report? Board Member Doyle, my question again, or not again, but my question is about timeliness. The data that we see here reflects calendar year of 2023, so January through December, save question number 1 and 3.
It's right there. Staff Member Melvin, on the cover page, it actually reflects from 2/1/2022 through 6/30/2023. It's 17 months worth of data, I believe. Well, for measures 1 and 3.
So save 1 and 3, the other timelines for number 2 and others is the calendar year, January through December of 2023.
I'm gonna turn it over to staff member Hennigan. I believe that's correct.
Apologize, I don't know the numbers of them, if I could see the list.
Just for overview, yeah, it has the date collected, it just doesn't list a year,
Yeah,
so.
it's for prior year.
Non.
Thank you, Board Member Beaman, for identifying that on KPM number 2 on page 5 of this document, that it says date and collection period January 1st through December 31st. So, so that answers my question. That is the calendar year. I believe that I missed it or am misremembering having seen that before. The reason that I was asking this question is thinking about timeliness in terms of is it appropriate for us to review this at the June meeting as opposed to an earlier meeting? And I think that because the data is collected through December 31st, that then board staff have to reconcile the data. There really is limited opportunity for the board to receive it any earlier than June. And so I'm sharing my thought process, my finding that I'm agreeable and don't have any other suggestions to potentially improve this process for future board evaluation.
And Executive Director Fox, President Doyle, members of the board, one of the things is we missed the deadline this year, but with the next board, if there are certain key performance metrics that you believe the agency should be looking at for the different programs that we have within the agency, the time that we'll have that conversation would be, I think it's the first or second quarter of 25. So it'll be within the long session of the legislature, because we would have to go before the legislature and share what questions or metrics that you want for us to put before the legislature, and it'd be up to the legislature to decide if that's appropriate or not.
Member Doyle, any other questions for Executive Director Fox? Seeing none, we'll close conversation on package Foxtrot 1. APMs. We now will move to view some requests with staff member Effermoff.
RJ.
My script says Effermoff.
It started with you.
Member Eskerma is going to punt to staff member Davis, who has been kind enough to help me on all of these.
Give me just a second to pull this up. We concluded that discussion very quickly. Okay, which one's right?
Mailing June.
Where's that? Okay, for those on the phone, this is mailing G related to Lincoln County. The three waivers that I'm going to go through are all related to the same rule. And so at the conclusion of discussing each of the waivers that are requested, I'm going to come back to you with a question about whether you want a rule change to be initiated or not. I'm not going to discuss it with each one. We'll wait until we get the full picture. So Lincoln County Public Health and Human Services is a small rural public health department located in Newport, Oregon. And they're seeking review and approval of a request to the Community Health Center, CHC security rules. Specifically, the rule is OAR 855-043-0720 for community health clinics. Only a physician, clinical nurse specialist, nurse practitioner, or registered nurse shall have a key to the drug cabinet or drug room. In their absence, the drug cabinet or drug room must remain locked. This facility has a single registered nurse or RN with access to the medication room who is responsible for dispensing medications. They have asked to ensure adequate staffing and patient care. They would like to have an additional licensed practical nurse to have access to the medication room. From there, with information they provided us, restricting access to only the RN creates a potential bottleneck in their service delivery that impacts patient care. And granting access to the LPN would improve efficiency and ensure continued service in case of the RN's absence. We had gone back and asked them about their policies on security of drugs and how these, how the what are we looking for the LPN, like how they're trained. They have a policy, like an internal policy for the health, the CHC, that requires that they maintain control of all medications. All prescription medication is kept in locked areas. There's limited access to the medication, and only keys to the locked medication areas are limited to the designated registered nurses currently. If this waiver is approved, then they would that give access to the LPN. Their locked medication cabinet is in their locked public health lab, which also has restricted access only for staff that has direct business in the labs. There's kind of a double level of security there. In terms of training, the LPN that they are wanting to give access to has taken like introduction to pharmacology at local community colleges, has read and reviewed the policy about their drug storage and handling. It has references for the nurse's drug handbook. In terms of who is responsible for making sure and ensuring the security of the drugs, the program manager for communicable disease prevention and immunization oversees the safety and security of medications at the clinic. The program manager is responsible for ensuring the medication logs are filled out correctly, and reconciliation of the medication inventory occurs every month according to their policy. In addition, their medical officer approves all medication administration prior to its administration and notes it in a medical record. So for board discussion, would approving a waiver of this rule allow an LPN to access the medicine room, further public health or safety, or the health and safety of a patient? And we just need to know, if you approve it, what is the time frame for the approval, for like 3 years or 5 years? So I hand it back to you, Board President Doyle, for further discussion.
President Doyle, is it your request that we have conversation after each of the SBARs that are presented? Yeah,
For this, for the first bullet, the second bullet, I'd like to hold until we've had all 3 conversations and then look at it as a group, and determine if you would like to move forward with changing the rule.
Remember, Doyle, so the question that you would like discussed is, would approving a waiver, that bullet point only?
Yes.
Okay. If I may, actually, Board Member Mtg, you would go first, but if I may, I would like to ask Board Member Chin to go first because of her nursing background. Board Member Chin, is that okay with you?
This is Board Member Chin, and yes, that is fine. And function under the direction of an RN. And the RN can give direction to an LPN. I would assume is they're accessing the medication room, dispensing medications. If the RN can only do that if they are understood that the LPN has the knowledge, skills, abilities, and training to do such safely. And so if all of that is accurate, then for this particular exemption request, I would be in favor of granting an exemption.
Do you have an example timeframe for that?
I would say do a 3-year, and then when they come back with an SBAR, and you can, and everything's gone fine and there've been no issues, then you can determine if it can go further than that.
Member Doyle, thank you. Board Member Joyce?
Board Member Joyce, I've worked with LPNs in the military quite a bit. And they are, highly skilled, knowledgeable, and, as long as they go through the protocol for their training, facility-specific training, I'm okay with a 3-year waiver. My question is, what medications are in this law cabinet? Are the IV, PO, high-risk meds, controlled substances? What exactly is in this drug cabinet? Was that covered? Emergency medications, I mean, what?
This staff member Davis, I am going to see if I have that information.
I don't think it'll make me change my mind, but, if they're high-risk IV medications, they wouldn't, yeah. I don't know if an LPN is allowed to.
So the RN would not be able to delegate or not assign, delegate in these situations. Wouldn't be able to assign to the LPN if they're not.
But however, if it's stored in that cabinet, I mean, they would technically would have physical access to it, but they're just not allowed to administer any of those IV medications.
Excuse me, that was board member Chen. The LPN also has a responsibility to their license to not do something they're not allowed to do.
That I'm not disagreeing with. It's just, someone has physical access to something. But picking up with meds.
Staff Member Davis, should I pause or ask Board Member Patel to comment?
Staff member Davis, I pulled up their policy that they had shared with us. Some of the medications, this might not be an all-inclusive list, or like isoniazid, rifampin, vitamin D6, azithromycin, penicillin, diphenhydramine. There are vials and like medications that to be administered. I do believe there was also a conversation, could have been with this one, with vaccines being available for them. They did state that there are no controlled substances.
Okay.
That is 100% sure.
So no controlled substances, and it seems like the IV meds that are there are for like anaphylaxis or severe reactions. Benadryl.
Board Member Patel?
Member Patel, I do have experience with working LPN in other state. I didn't see LPN in Oregon. They're licensing under nursing board, LPN?
Member Chen?
They are RN, PRN, CNAs are all under the nursing board.
Not very, so they have common LPN here, right? I mean, I never heard.
There are
Nursing facilities have one.
And there's,
Yes,
okay,
absolutely, and facility health.
interesting. Yeah, I never seen in my clinic. So anyway, so for the LPN, so they are licensee. I do still have a little bit concern based on the medication this Joe, the rifampin, isoniazid. And then you also mentioned that there is a manager or program manager who managed the medication inventory or reconciliation. Is that manager is licensee?
I do not have that information. What she gave me was the program manager for communicable disease prevention and immunization oversees the safety and security of the medications along with the medical director or medical officer.
Cannot license, if you're not allowed, then how can oversee for that medication security? That's questionable. Then you also say vaccine and everything. So they're also, that program manager is going to be responsible for the storage of those vaccine, like temperature, storing temperature, maintaining and all those things. Who's going to be responsible?
According to their policy, that person is responsible for the medications.
But if he's not licensing, he or she's not licensing, means they have the access to that approval cabinet? know what I mean? Like, how can you manage the inventory if you don't have access to the drug?
Remember tomorrow.
The rule right now is they have to be a doctor or a nurse and to have access, right?
Yeah.
So
But she,
they would, that's our rule. They have to be a physician, a specialist, a practitioner, or an RN.
I understand. No, I agree, but not necessary all the time. But she said she don't know whether that program manager is licensee, and I'm not even looking for doctor. I'm just looking for license.
Staff Member Davis, wanted to bring to your attention, didn't have it in, I don't think I had at this mailing, but 855-043-0700, which is the purpose and scope of a community health clinic. It specifically lists, what a CHC can have in terms of drugs. So a community health clinic drug outlet registration, that has nothing to do with this. A legend or non-prescription drug may be dispensed to a client for the purpose of birth control, caries prevention, treatment of amenorrhea, the treatment of communicable diseases, hormone deficiencies, urinary tract infections, or sexually transmitted diseases by a practitioner who has been given dispensing privileges by their licensing board, a registered nurse, or who is an employee of the clinic or local public health authority and is recognized by the Oregon Public Health Division for the purposes of providing health services. So that's straight out the law that allowed these clinics to exist. If that-
Board Member Patel, no, I agree, and there's a law, but I have seen the clinic. The manager are not licensee and they have access to the medication cabinet, so that's what I just want to clarify. Yes, there's one thing, there's a law, and then there is another thing. They'll have access, don't follow the law. It's two different things. So that's what I just say. Does that person, program manager, is licensing? I don't feel comfortable on this one. I need a little bit more information. LPN access to the medication. RN, fine, sure. I'm fine with the registered nurse. LPN, I'm not sure. So my answer would be no.
Member Higgins.
Since I'm in favor of granting the waiver with 3 years.
Member Palmer.
Board member DeBarmore. This is similar to licenses that Washington has instituted across multiple types of buildings that have drugs. And this license, I'm curious the history of why a CHC has a license, a registration, I should say, not a license, but a registration. We don't have registrations for other places that have drugs that aren't pharmacies. So those are the things that boggle me, because LPNs would have access to medications in regular clinics because we don't have rules that say they can't. There's no rules. There's no words that say they can't. So it's an interesting conundrum. I'm absolutely in support of this. And I'm indifferent about the length of time. They're a licensee. They have obligations under their licensure as well as the people that oversee them.
Member Hall.
Board Member Hall. I'm in support of this, and I would say 3 years.
Member Beeman.
I remember being, I'm in support of this and I am fine with either 3 or 5 years, whatever the majority is.
Member Doyle. I would support a waiver of 3 years. Thank you.
This board member Chin, point board, I just wanted to ask a clarifying question. Under the, whatever license the CHC has, does the RN have to have the, dispensing? Is there any special dispensing thing? I know with APRNs, we have to have a special dispensing thingy with the board to be able to dispense, and it's a different part of our license. The rule delegate designates RN's ability to dispense medications found in Board of Pharmacy, OAR 855. Division 043 practitioner dispensing rules. The RN who dispensing shall comply with OAR. So there is no OAR for an LPN. So this is where we're asking for the exception to this rule. So the LPN can do this RN dispensing. Is that correct?
It's just access.
So this Lincoln County, the RN with access to medications responsible for dispensing medications. This is talking about when the RN isn't there. Potentially would improve efficiency or continued service in the RN's absence. So if the RN isn't there, is the LPN doing the dispensing? That's what I'm assuming. And so this is actually a not only access, but a dispense rule. Correct me if I'm wrong, but is that that's what we're being asked, correct?
Staff member Efremov, that is not the ask at this time. The request is a waiver related to security and access of the actual medication room. But I think to the point you're raising, and we could get additional information if needed to pass this, is if there is no RN there, are you not then dispensing that day? Are you maybe only administering? Back to the interesting structure of our statutes, that we have in our statute an authority that allows RNs to dispense in a very specific setting. We don't necessarily regulate the RN. That would be on the nursing board, and if they need a dispensing privilege and who's allowed to dispense or not. And hearing from you, and perhaps I'm deficient in this, knowing my understanding is an LPN, I don't know if they can dispense or not. And if they are not permitted, that is not what is in this request. So we could ask a clarifying factor, or if you need us to request this, be brought back, we're happy to do that too. But the current request on the table is just access to the bedroom, not for an LPN to dispense, as that is not your jurisdiction or authority to say so.
Says Board Member Chin. So access is different, and that's what's confusing to me in the assessment. Granting access, yes, it would improve. I can see how it could improve efficiency and ensure continued service. But when they're saying in case of the RN's absence, what does that mean in terms of what is the access allowing the LPN to do? Is the access allowing the LPN to be assigned to do the RN's tasks, which would be the RN's ability to dispense, or an LPN does not have in ONA rules, dispensing authority. But that would be, so it would be, and their dispensing authority is under our rules, right? So it's not in ONA's rules. It just is mentioned that it's in Board of Pharmacy rules. So I think we might need more information about what is the LPN actually doing with the access.
To Staff Member Davis, I may have not put that correctly on the assessment, to be honest. I'm looking back at the original email, and the only ask is, we are a small rural public health department. We have a dispensing RN with a key to the medication room. However, we really need our LPN to also have access to the medication room. They're not requesting dispensing privileges even in the request.
They're not explaining why.
I don't have further information. I just have the request.
Are the drugs they dispense?
You need to make,
Sorry.
sorry. Mine won't read.
This is Board Member Chin, and I'm just looking at the assessment line on the SBAR. It says in case of the RN's absence.
I was using similar templates between the three. I think this may be a similar template issue rather than that actual facility making that request. We can strike that sentence if that is what is causing a problem, because they did not.
I think we need to strike the sentence if that's not what's happening. And so if it's just access and they're not dispensing, then I'm comfortable with that. And that would be fine.
Just one moment. Officer Murphy, Stefan Merch, did they include in their
request whether if the medroom contains medication dispensed by RNs pursuant to CHC, like the birth control, if that medication is stored in the same room as medication that's administered in the clinic, which wouldn't require registration with the Board of Pharmacy.
I do not have that information.
I'm wondering if it's all in the same room, and since if it wasn't separated out, that you would have, in order to enter the room at all, you need to be an RN. If it doesn't have a separate, like, locked cabinet within that room.
That answers the question about.
Remember Hemmons?
Board Member Hemmons, board staff, Jennifer. You read back the exact wording of what they were requesting,
Yes.
please?
Give me just a second to reopen that email. So the original request said, we are a small rural health public health department. We have a dispensing RN with a key to the medicine room. However, we really need our LPN to also have access to the medicine room.
Board Member Hemmons, thank you. So they didn't say why? For what purpose? Just that they needed to have access.
Correct.
Thank
Member Doyle, Officer Murch, you're suggesting that access to the CHC related medications could be in the medicine room, and that an LPN, the question at hand could be them asking for access to the medication room, and therefore an LPN would have access to many more medications, which they might not, or should, or do not have, or should not be able to enter.
Step and emerge. So I've inspected some CHCs where they have a med room for all the medication, but within that med room, they have a locked cabinet specific for RN dispensing. And only the RNs have access to that cabinet, but other staff may have access to the med room. Other stuff in the med room isn't under our purview, it's under the, whoever the provider is.
We were able to get in contact with the person that submitted the request. They're coming on the phone line now, so just give us a moment. Welcome to the meeting. Callie, this is for staff, our agency staff, Jennifer Davis. We had emailed a little bit. Our board is discussing your waiver, and I think they've come up with some questions that they would like to ask. Can you respond to their questions, please? She just left. Hold on, I think she's muted.
Okay, there you go. Sorry about that. I was trying to get my headphones on. Are you there?
We don't have to speak. Yes, we're here.
Okay.
Go ahead, whoever has questions, please.
Board Member Chin.
Board Member Chin, hi, this is Board Member Chin. Can you explain to us what the LPN's access is going to allow the LPN? Because there's some confusion about the RN has the dispensing authority in your clinic.
Mm-hmm.
Are medications not secured separately from the rest of the medications the LPN could typically access then?
We have very limited supply of medications. So all of our medications are in our lab, which are then in a locked box, essentially, that the RN can access. So we really only have STI medications and wound care antibiotics, and then vaccines. So our vaccines are accessible. They're not behind a locked box, but all of the medications are.
And what would the LPN's access to the lockbox be improving in your care then?
efficiency. So our RN who has access to the lockbox actually works for Maternal Child Family Health, and she is the program manager for that department. So she's super busy and can't be as involved in the day-to-day work that we do in communicable disease. So by allowing Janet, the LPN, to have access without having to get in touch with to our RN first, we can expedite treatment to some of these hard to reach folks. And we're also talking, it's not like a huge volume of people. We're a pretty rural county, but the people that we do see are the ones who tend to be homeless, or they don't have medical care providers, or they've experienced stigma in the field. So if we can get them when we have them on the phone or when we have them in front of us and are able to treat them right away, it's just a much easier and likelihood that we will get to them.
Okay, and so are you treating them in the clinic, or are they being dispensed medications to take after they leave the clinic?
Typically, I think there's only one STI that requires the dispensing. I believe that's gonorrhea. I'd have to look at the treatment plan again. I don't recall offhand, but there's only one that requires medicine to be taken home. Most of the others we can give in the one shot of azithromycin or the Bicillin for syphilis.
So my understanding, and please correct me if I'm wrong then, is that the request for a waiver is because you're asking the LPN to actually do the RN role of following a protocol for the diseases that your CHC treats.
Yes, but with the caveat that before any medication is given or anybody is treated, she contacts our medical director. They discuss the situation and make sure that the treatment course is what the medical provider wants. Because for some of these STIs, there can be like two routes. One could be just the one-time shot, or one could be taking pills home. So before anything can ever be given, she has to discuss that with the medical provider who will approve the course.
So the medical provider is approving the medical course to the LPN then.
Correct. Mm-hmm.
Okay. And is that the process that you are documenting in your, in all of your stuff for when somebody might come out and inspect, that there's a process for this? Okay.
Absolutely, absolutely. We're building that right now. Currently, we have paper charts that we fill out, but we're in the process of getting this into a system called OCHIN, which you might have heard of. And that system's going to allow Dr. Long, the medical provider who will approve all of these treatments, to go in and sign off and say, yes, I did approve this.
Yes, that absolutely needs to be done.
Yeah, well, yeah, I mean, yes, it does. I'm just saying, yes, we will do that. Sorry.
Okay. Okay. I have no
Maybe I
further
didn't answer your
questions.
question. Did I answer your question?
That explained a lot to me, more than what the request actually said, but yes.
Okay.
Any other board member questions? Any agency staff questions to CAC?
Member Ekbach, just to state for the record to what is permitted via the CHC is for an RN to have that exemption, the permission to be able to offer an RN to dispense under this registration. It doesn't necessarily state that an LPN is dispensing. I don't know all the regulations of the practitioner or what the licenses of the practitioner was working with that LPN to dispense. So just maybe give a recommendation to ensure that if it's personally dispensed from that practitioner's regulatory board, that intentionality and regulation is being met, and understanding that it's not this board necessarily giving the authority, as that is not within the current rules to permit an LPN to dispense at this registration, if that makes sense.
Makes sense.
Board member Hammond, just a point of clarification. Compliance Director Efremont, you're saying that this board cannot say that it's okay for the LPN to dispense because we don't regulate the LPN license. Thank you.
But we are, this is board member Chen, but we are able to grant a waiver with the caveat of what agency staff, Eperma, had stated that with their processes of whoever's license is covering the LPN's actions, so everything has a flow and there are responsible people. Responsible licensees under their rules.
Other questions from board members for the requestor, Lincoln County CHC?
Oh, okay, thank you. Sorry, I wasn't sure. If I understand the question, yes, we have processes in place for the LPN to follow the chain of command up to the medical provider who would ultimately be responsible. Does that answer the question?
Correct. So
Okay.
the medical provider would be in essence, ordering the treatment.
Correct.
And the LPN providing the either dispense or the treatment.
Correct. Yeah. And all of that again would be documented.
You have no
And-
further questions. This is Board Member Chin.
Member Hemmons, so, if we were to grant this waiver, does this, and does the waiver cover, for this entity, all LPNs that may be employed by them, or just this specific NPN?
Staff Member Efremov, it is currently proposed as any LPN. If the board would like to restrict it to a person, I can give a little bit of a historical reference. There have been similar requests in the past where the board had permitted per person, but due to staff changes, I think most specifically around COVID and other times, it became a bit of a barrier to get that put back in for that waiver to be able to expedite care to patients. So the board in the past has given us guidance to request these as the physician as opposed to the person, but that is the board's prerogative to do as you see fit.
Board Member Hemmons, I just wanted to clarify that they wouldn't need to come back again with another waiver if we were to approve this one. Thank you.
Board Member Doyle speaking for board members. Is there a motion to approve the request of Lincoln County Public Health and Human Services for granting access of an LPN to the medication holding area for 3 years? So moved, Board Member Joyce. For a second.
This is Board Member Chin. I would like to modify that. I would like to put in qualified LPN.
Can I ask what that means?
I understood the motion to include LPN. If I heard it correctly.
Yes.
So I would just ask for clarification about what a qualified LPN is. I don't believe there's a different form of licensure.
Okay, noted. Never mind. It was made, there was a reference to that up above in the A in the first part. I'm comfortable with the LPN and I'm happy to second it if it has any second.
Been a motion and a second. I will go around for a roll call vote to approve the request from Lincoln County Public Health and Human Services to allow access for an LPN to their medication area and for a 3-year period. Board President Doyle, yes. Board Vice President Chin.
Yes.
Board Member Beeman.
Yes.
Board Member Armore. Board Member Hall.
Yes.
Board Member Hemmons.
Yes.
Board Member Joyce.
Yes.
Board Member Patel.
Board Member Patel abstain.
Motion passes with Board Member Patel abstaining.
Board Member Hemmons, was there a motion, did the period of time, was that included in the motion? Would that be a separate motion?
Council AG Bertoni, I heard a 3-year term referenced in Board President Doyle's motion.
Thank you, Representative from Lincoln County for joining us on the phone. I believe at this time we've concluded and you can disconnect. The time now is 11:06. Is it okay with staff if we break for lunch? 12:06, sorry, 12:06. Is it okay if we break for lunch at this time? So we will be taking a 1 hour break and resuming open session at 1:06 PM. For the public in the room, we kindly request that you vacate the room so that we may secure it. Thank you for your cooperation.